Good morning. Good morning, and thank you for attending today. Today I'm joined by advocates representing the full continuum of long-term health care services for our state's seniors. As Florida citizens continue to age and our state focuses on how we're going to meet the demand for our baby boomers, it is important that we maintain a comprehensive and organized approach when it comes to health care planning. Currently, Florida has a certificate of need laws in place which promote delivery of high-quality health care and ensure that services are aligned with our community needs. CON is also designed to ensure that care is also delivered efficiently and prevent the unnecessary growth of our Medicaid budget. Legislation in the House and Senate being considered today, however, is an attempt to preempt the current CON process by creating a special exemption for deed-restricted communities. Attempting to reform the CON process through individual piecemeal exemptions is not in the best interest of our state, which has a responsibility to ensure quality, affordable, and adequate long-term care services for the seniors within all communities, not just one. Nursing home providers, as well as those providers who give seniors the opportunity to age in place through home and community-based services, have come together this morning to discuss this important issue. I'd like to welcome Deborah Franklin with the Florida Healthcare Association to share her point.
Good morning. My name is Deborah Franklin, and I'm the Legislative Committee Chair for Florida Healthcare Association. We are the state's largest advocacy organization representing over 500 skilled nursing facilities across the state. I also serve as Director of Operations for not-for-profit Florida Living Options, and we operate retirement communities consisting of skilled nursing, assisted living, independent living in Florida. I'd like to thank Senator Garcia for your leadership on this very important issue. As Senator Garcia pointed out, the current Certificate of Need law is working to control the cost of the Medicaid program. It also encourages home and community-based care and ensures the optimum use of nursing home care based on the need and demand for these type of services. I think it's important to point out that nursing homes in Florida do not operate in a true free market system. The legislature sets Medicaid rates for nearly 60% of the more than 70,000 nursing home residents in our facilities. A full 80% of our residents rely on government funding to cover their long-term needs. A free market system would not continually chronically underfund the cost of care as Medicaid does for our residents. The current Certificate of Need law assists nursing homes with managing the underfunding of rates by maintaining efficiency, occupancy levels, and a balanced mix of Medicaid, Medicare, and private pay residents. The current CON law is working. Underutilized beds in communities are moving to those areas where there is a need for nursing home services. Just recently, I was able to open a brand new state-of-the-art facility in Sarasota using this current CON process. And you'll hear from my colleague in just a moment about how he also followed the appropriate steps to open a new skilled nursing facility. While this bill may seem to have a limited impact on a single deed-restricted community, we have great concerns that it may cause unintended consequences across the entire state of Florida. It fails to adequately recognize the long-term care needs of the residents in the surrounding counties which exist outside the village's development. In addition, nursing homes and seniors will soon be affected by the implementation of Medicaid managed care, and the uncertainty of how we will be affected is also important to this issue. Florida Healthcare Association strongly opposes Senate Bill 1482 and House Bill 1159. We hope legislators will recognize the need for a more inclusive approach to healthcare planning that consists of the full continuum of long-term care services, not just the needs of private developers. Thank you.
Thank you, Deborah. Now we have Jack McRae with AARP representing our seniors in our great state.
Thank you, Senator Garcia. Good morning. My name is Jack McRae and I represent AARP. There is and will continue to be a need for a viable nursing home industry in Florida. Some infirm, older, and disabled adults need the hands-on 24/7 care they can receive only in nursing homes. However, the vast majority of Florida seniors, for the vast majority of Florida seniors, there truly is no place like home. In every instance of AARP's opinion polling, seniors overwhelmingly prefer to age in place, and if they need long-term care as they age, they prefer to get services that allow them to remain in their homes and in their communities. But for so long, Florida has put too much resource and reliance into funding for nursing homes at the expense of insufficient home and community-based services. That's one reason why Florida instituted the moratorium in the first place on new nursing beds. As more seniors have used home and community-based services, the demand for nursing home beds has lessened. But apparently some developers believe in, and if you build them, they will come philosophy. They will market and encourage residential institutional care instead of home and community-based services. But keep in mind, the market cannot absorb so many nursing home beds. The cost of those unfilled beds pass on to consumers and to taxpayers. Or the new facilities take residents from existing nursing homes which have relied on, operated under, and made plans based on the moratorium for nursing home beds. Or finally, it makes investment in home and community-based services less attractive. The interest wanes. AARP opposes legislation that would lift the moratorium or which would create special exemptions to the moratorium. Let's not distort the long-term care market by saddling it and Florida seniors with unnecessary nursing home beds and too few home and community-based services. The legislature instead should emphatically endorse what has been a resounding success, nursing home bed moratorium. Let's keep our seniors in the homes and communities where they can remain viable and productive members of their families and communities. After all, home is where the heart is. And if the legislature is truly concerned about health care and long-term care cost containment, they will not touch the moratorium. Thank you very much.
Thank you, Jack. And next we have Steve Vogel, who has a handful of nursing homes around the villages and offers great quality care to those residents, to give a couple of remarks as related to this bill. Steve?
Good morning and thank you for being here today. And I wish I actually wouldn't be here right now. About a week ago we had thought that we'd met with all the parties involved and got them to reasonable language that would actually benefit Florida seniors going forward. As Senator Garcia said, I own quite a few facilities immediately surrounding the villages. There are actually 4, of which one is brand new, that last week on Thursday got its approval to actually start admitting residents. It's a 120-bed facility. The issue at hand is, more importantly, not who the villages are or who the people are or who the developer is, but the issue at hand is the actual legislation that's being presented in front of the House and Senate over the past few weeks and going forward till the end of the session. The legislation is based on a report that was created stating many things which are actually incorrect about the needs in and around the villages. The report states, for example, that it's not feasible to build under the moratorium, and the moratorium has actually hurt and held back the ability to build. The answer to that is absolutely not true. I'm building a building which actually just opened. I'm building another one down in Broward County in Miramar, Florida. Debbie Franklin just completed a facility in Sarasota, and I can go on with countless others that are actually building. The next statement they say is that the distances between where the village's residents are and the facilities are actually too far, and it changes their culture. Well, what is the difference between the village's residents and their elderly population versus any other elderly person in the state of Florida? There are 3.4 million elderly people above age 65 in the state of Florida that we have to think of. Based on their theory and logic, the Senate and the House today should say, well, we're going to allow a nursing home to be built every 15 minutes of a drive. The logic is not correct. The moratorium was created so that beds in areas that are underutilized get relocated. I've done that. I've followed the rules, built within the confines of the moratorium, and I'm looking to do it again and again. I have existing facilities in other counties like West Palm Beach, for example, which are older facilities which I'm looking to replace. You're going to say it's not feasible? I'm doing it. The villages had the opportunity to have a facility built within the villages by myself on 3 separate occasions. They decided not to. They actually said they have a contract with another healthcare provider. But now we're hearing that they want nursing homes in the villages. The answer to that is the state has a fiduciary duty to protect those that have followed the laws enacted by the House and Senate. They have to protect those and they have to stand by it. What we're asking for is that the legislation that is going to be written, which is for the future of Florida's seniors, be written in a smart way, taking into consideration the existing facilities that are currently servicing the area. Might I just add one thing? Within a 5-mile radius around the villages, and including those that are literally a stone's throw from the village's borders, there's a total of 1,025 beds. The occupancy rate between all of those buildings has a total census of occupancy of 800. That means that it's an 80% occupancy rate. The report that I have in my hand, and what was testified, states clearly that the need is immediately now. I don't see an immediate need when you have an 80% occupancy rate and 200 vacant beds available for our seniors. In the 6 years that I've been operating in that area, I don't recall a single day that there was an elderly resident in an area hospital that had to wait to be placed in a nursing home. I think the message to be sent to the legislature is that they have to represent all of Florida seniors, all of those that have followed the laws and built within the confines of the state laws. And when they enact legislation, they have to put certain thresholds in before buildings just be given to be built by developers outside of the regulation that ACA would normally oversee, and the other nursing home owners can have an input. Thank you for being here today.
I think Steve said it eloquently. The truth of the matter is we should protect all seniors, not just a single community in our state. These rules are in place for that simple reason, to protect the quality of healthcare delivered to these seniors. How we're not going to take that into consideration when we're considering this bill. And I'll tell you, it's just incredibly important. If we do have an issue with the CON process, let's look at the CON law and have a comprehensive approach at reforming it, not just for the basis or the economics of one basic community. Our seniors are more important than that, and we must protect them at all costs. With that, if there's any questions, please, we're ready to answer any questions. Folks, good? Steve?
Sure. Can you address why you or some other operator has not been able to reach agreement to go in? If you can move beds around and build new facilities, why you've not been able to reach agreement to actually build it within the villages as opposed to building your...
Well, we approached the villages in 2007 requesting to buy land from them and build a facility on it. They told us they had a contract with another provider, so pretty much they said no. We then came back in 2008. There was some land behind the Lowe's Improvement Center we wanted to purchase, which didn't have enough water and sewer. We asked the villages to allocate some additional water and sewer. They said no, we need it for our future development. We went back to the villages a third time, and they basically said no again, we have a contract with an outside provider. At that point, you say, okay, and you build as close as you can. So we built literally across the street from the villages. We've tried. The villages controls everything there, water, sewer, electric, special taxing districts, you name it. You know, you're at their mercy, and if we have attempted to work with them. I could say I still would attempt to work with them. I still would work with them in the future. But they have to open up and they have to be willing to work with you in a fair, you know, marketable way that we can properly, you know, compete.
Right.
Senator Garcia, can you address, from your perspective, what's the likelihood that this legislation has a passive decision?
God, if I knew that, I'll give you, win the lottery. I don't know. I just think at the end of the day, I think when the legislature, and at least in the Senate, we take a real look at this and we start evaluating what's in it for our seniors. I think that's a question that we need to ask ourselves. And the truth of the matter is there is a process in place. Let's follow that process. If we don't agree with that process, let's open it up and review the process entirely to make sure that we protect the well-being of our seniors. At the end of the day, that's the ultimate goal of this legislature, is to help those that can't help themselves. And why are we going to benefit one group over the other based solely on economics? It just doesn't make sense to me.
Do you see any need for change in the CON process?
If we look at CON, I think we have to look at CON and take a comprehensive approach at all of our CON laws, not just as it relates to long-term care. All right, thank you.